You know, as everybody's aware, we talk about money in many different frameworks. We talk about money on many different levels. So let's talk about something in terms of let's make it easy to pay. You know, money's not a dirty word. You follow the money, because if we think about what we're trying to do, somehow in healthcare, money has the stigma of being, listen, we're healthcare providers. We don't want to talk about money. You know, it's all about the people's health. It's all about looking after their welfare. We can't talk about money. But what we know in what we're doing right now, the relationship that we have is we're about creating great value for our patients first. We want to look after our patients and our team. Money is a big part of the equation. It's something that we're happily paid for. It's a reward for what we do. It's what makes the whole engine go. So it's not a bad thing to talk about money. It's the frame of reference we have it in. So let's talk about money from a patient's perspective. We want to make it easy for them to pay. Have you ever been to a place and you can always tell how good a business is by how easy it is to pay? And it's insane that we go to some of these businesses and it's difficult to pay. It doesn't make any sense. So how do we make it easy to pay? And the money conversation somehow in dentistry is about, well, they pay at the front desk. We don't have to talk about money. We want to make it comfortable for our team to understand this is a full team task. Making it easy for our patients to pay happens at every level. Now, if you look at it as a very positive thing, we want to look after your money. We want to make it easy for you to pay. We have to have a lot of understanding of how do we maximize the patient's ability to pay as a benefit. Obviously, insurance is a big component in dentistry. So we want to understand their insurance. We want to be transparent with what it is. We want to facilitate their insurance. Their insurance, sure, it's a contract between the patient and their company. We're a dentist. We're healthcare providers. We don't want to get involved in that. That's a pile of crap. We're there to look after our patients. Now, our patients, I can't imagine having a patient to say, don't worry, doctor, I'll look after my insurance company. I'll just happily pay you first. If they're given an option to say, Mary, we'll just look after everything. We love your insurance. We're going to make it easier for you to pay. Oh, who would say that's not a good thing? So we're there not to overutilize insurances, to make it very clear that these interfaces have to occur and everybody's got to be aware of it. Everybody has to be comfortable. It's a wonderful thing to do what we do, to clearly communicate. There's that word again. Communication and money have to go hand in hand. Now, communication and money have to go hand in hand with people have to understand what they're communicating about. If you make mistakes communicating about money, that's where your problems lie. If you were to go to most places, most businesses in accounts receivable, the complaints department, if there was such a thing in customer service, I guarantee you most of the complaints have to do with money. So let's take that off the table. Let's take that elephant out of the closet. We want to be prepared to deal with conversations about their money. We want to facilitate those conversations, their money, their benefit, making it affordable. Look at these words, people. Affordability. We want to make it affordable. Payment plans, understanding what it is, maximizing their insurance, being aware of it. And here's another thing. If something is a conflict with them, let's be a healthcare provider. Just look after them first. And if it's not covered, if it's one of those things where you've got the time, just courtesy it. What is better than that as far as building loyal patients that refer other patients to you? Now, be careful with that. Doesn't mean we're always going to be giving dentistry away. We're our business. Our people deserve to be paid very well. We understand what our compensation programs are based on. We want to transparently share this thing. Transparency in money is very important. So let's talk about some of the things that we say. So right away, when you're talking about treatment, we want them to have the comfort where our financial coordinator knows exactly where they are in their insurance benefit situation in the year. We're going to look after that for them. We're going to understand that there will be a copay. Here's what this is. Here's how we're going to make it easy for you to pay. Does it work for you? Now, here's the interesting thing about a money conversation. Do not always assume that everybody can pay. That's a very difficult, delicate conversation. They need to know when it comes to money, they have very clear options that work for them. It's not just they need this treatment. What does that mean? They need this treatment. Well, I mean, in a clinical situation, we need we are obligated to let them know exactly what they should have clinically, what they need. Now, need is a very different thing. Now, when the financial conversation comes in, again, let's make it easy for them to pay. So the financial discussion has to respect where the patient is in their very important life of their affordability to pay. They may not be able to afford to pay. Well, you still want to look after the patient. What can they have done? What can you do for them? So your treatment presentation have to give them options. The correct treatment choice for them, and it usually always comes down to money, is this. We're going to do the best thing we can to make it affordable for you. And what does that mean? What that means is you have to have a trusted situation. Isn't it interesting how we always circle back to the foundation of trust? If you've established this trustful foundation to have these conversations, it becomes an easy conversation when you get on their side. They're not embarrassed by it. You actually quickly have to read the patient and their discomfort. It's not like, well, I need to talk to my husband. Well, most people like to get out of these conversations and they leave it hanging. It's okay that you do something in more of a temporary situation that works for them. Planting these seeds, which have trust at the very foundation, now you're setting up for seeds that can really come to fruition as long as you understand that their money equation, making it easy for them to pay, has to be satisfied. Money is a very, very difficult conversation for a lot of people. So make it easy. Make it easy to accept what they need, make it easy to accept what they want, and it happens at the front desk, it happens with the doctor if it comes up. The doctor should not say, well, I don't have to do anything to do with money. I don't know what that is. Well, what is that? Aren't you part of the team, doctors? We're going to make it affordable for you, Mary. You don't need to know what it costs. Sometimes they don't want to have that conversation with a doctor, but at least leave them with the impression we'll do everything we can to work with you and your insurance. We love your insurance. We're going to do what we can to make it affordable to you, and something that works for you, Mary. Affordability, just by giving them treatment plans to say, you don't stop at saying, well, we'll let you pay over a defined period of time. So then you're assuming now they can pay it in 3 months. Well, I mean, that's a big assumption. They may not be able to afford it at all right then. It's got to work for them. We can give you a payment plan, but it's got to work for you, Mary. We totally understand that. We're here to do what we can to help you. Look after your patients first. The practice will look after itself. But when it looks after itself, what that means, you're going to get a lot of rewards as long as you handle that all-important money conversation. I'd like to give you scripting, but you know what the scripting is? Tell them we'll do everything we can to make it affordable for you, and believe it. And you need to find out what that means in terms of what that conversation goes with the patient. Give them options. It's okay. A complaint, get on their side. Trying to have some understanding of where they're coming from. When you can get that trust, again, here we go. Every situation in the dental office has to have trust. Authenticity, trust follows transparency, trust follows the fact that they know you're looking out for them. Their health, their money, their family. You're going to keep long-term patients, and I got to tell you, do not prejudge what they can and can't afford. Sometimes you're looking and say, they can afford this, how do you know? Or they certainly can't afford that, how do you know? You don't know. Let them, in the frame of reference that they're comfortable with, discuss it. If you get the art of that, and there is no real scripting. I could sit here and say, well, use this script, use that script, this script works. You know what works? Getting into great conversations with patients where you connect with them, look them in the eyes, make them feel comfortable, and get the people that get the face-to-face. They get it, they know it, they can have these conversations. Those are the key people you need that are your financial coordinators that can get on their side and they look and they can understand, they can show people are visual so they can see it, they can feel it. The money conversation will also mirror the sense of urgency they have. If they can't see it, they don't understand it. And if you then go ahead, let's go the other way. A lot of dentists have the disease to please. They aren't interested in the money conversation, so what do? Well, we'll just look after it, it's okay. Well, you need a crown, but if you'd like to have a filling, that's okay. So what's the patient thinking? Well, I guess it's okay. Do they want to say, no, I want a crown, doc? Well, we can do this or this, but if you'd like a filling, I'll do a filling for you. Well, it's because a lot of dentists don't want to hear no. They don't want to get into money conversations. They don't want to have that conversation, that disease to please, where somebody would say, I got to tell them they need 2 crowns, but I know that's tough because that's going to be $1,800. Oh, I don't want them to say no. I want them to like me. I want them to be pleased by me. Well, there's different ways to have the conversation. So it's important to marry together the fact that do they need it? What's the significance of it? Is it good for their health? I'm not getting away from that. Is it something that they want to have a strong biting surface on the tooth to last a long time? It becomes a money conversation no matter which way we go with anything. So the scripting is make it easy to pay, trust, get into a trusted conversation, and understand that affordability is enormous for every patient.